Good afternoon. This presentation is prepared by Dr. Brian Delage from the Department of Family and Community Medicine at the University of North Dakota School of Medicine and Health Sciences. Today we are going to discuss the Timed Up and Go test, or TUG, which falls under the 5 M's relating to mobility. This would help meet competency under the second competency mobility of the AGS Minimum Competencies in Geriatrics for medical students, where number 5 is functional assessments. This test helps us assess our patient's mobility and balance and is applicable when we want a way to formally assess our patient's ability to stand and walk, and gives us a number we can use to see where they might be at and help us in assessing risk for falls, and as a tool to help us see when we might need to consider interventions or activity that may decrease fall risk and improve our patient's safety at home. This test, developed in 1991 by Pudziato and Richardson, is one way we can assess mobility and balance. There are different components to test. First, the start position. The participant needs to be seated in a chair with armrests. Next, the execution. We ask the patient to stand, walk 3 meters or 10 feet at a comfortable pace, and turn around the cone and walk back to the chair and sit down. When the patient starts moving, we start the clock, and when they have sat down, we stop the clock. Lastly, we record the time it took for the test. Before performing the test, set up the course so there is enough space. Make sure to use a standard chair with a seat height of 45 centimeters and one that has armrests. Make sure to give patients instructions to wear comfortable walking shoes so they are prepared to do the test. Before they start, give them instructions and then tell them to begin when ready and walk at a comfortable pace. Monitor so they turn safely and return to the sitting position, and start the clock when they stand and stop the clock when they sit down. For an example of how the test is performed, please click on the link and access the videos provided in your LMS. When interpreting the test, the following times are considered. In general, if the participant can perform the test without any assistance in 10 seconds or less, that is considered normal for a healthy adult and no intervention is needed. If the participant scores between 11 to 20 seconds, they may be having some mobility challenges, and further assistance with strengthening, therapy, or exercise, or an assistance device may be warranted. If the participant completes in greater than 20 seconds, they are at high risk for a fall, and it is prudent to intervene with assistance of some kind, with physical therapy, use of an assistance device such as a cane or walker, strengthening, or both. While monitoring the test, you should be paying attention to the patient's posture while standing and sitting back down, and note any difficulty with this part of the test. Watch their walking speed. Can they walk at a brisk speed and yet remain steady on their feet without a risk for falling? Do they easily turn around the cone? Is it coordinated, and do they seem to be well balanced? Make note of whether they require any support or use any walking aids to be able to complete the test. Where can this be applied? It can be used for general geriatric assessments for those who are here for an annual wellness exam. We can use it with patients who are undergoing some rehabilitation to look for any progress, and we can use it after surgery to see how patients are doing with mobility and balance as they recover from their surgical intervention. The benefits of this test are that it takes less than a minute to do the assessment. It is non-invasive, it can be followed over time for improvement or changes, and provides information for us to personalize care. So, in summary, the Timed Up and Go test is a simple and effective tool that can help us assess mobility, balance, and fall risk. The results from the test can help us individualize patient care plans and can be reassessed to look for improvement or deterioration over time and help guide our referrals and interventions. The test is timed, and the time it takes to complete the test helps stratify potential risk. This should help healthcare providers create a plan for management of this patient, and doing the test consistently and the same way each time gives the most reliable results. Here are the references related to this presentation. Thank you for listening.